Today we will learn about the etiological classification of chorea. First is the developmental and aging choreas, hereditary choreas. Third is the drugs which causes chorea. Fourth, the toxins which causes chorea, metabolic causes of chorea, infectious causes, immunological causes, vascular causes, tumors, trauma, and miscellaneous causes. So what are the major categories? Firstly, the any congenital history, that is the developmental history or the hereditary history. Then always take the drug history of various drugs and the toxins, any metabolic cause, infections or post infections, various infections which can lead to chorea, immunological causes and the vascular causes, then trauma, tumor, infections, and miscellaneous. In the developmental and the aging choreas, we have the physiological chorea of infancy, cerebral palsy, in which we have kernicterus, buccal oral lingual dyskinesia, and in older patients senile chorea. So this can be if a child is presenting to you, it can be a physiological chorea of infancy, and if an adult is there, a senile chorea is also a possibility. If there is history of any kernicterus, then cerebral palsy, anoxic chorea, or because of kernicterus it can lead to chorea, and then we have buccal oral lingual dyskinesia. Then coming to the second category, we have the hereditary disease. That is, there is a strong family history in which we have the Huntington's disease, benign hereditary chorea, neuroacanthocytosis, and various Huntington disease-like disorders. And then we have the neurometabolic disorders, in which important causes like Wilson disease, Leishman syndrome, lysosomal disorder, Leigh's disease is a possibility. So in the second category, in the hereditary choreas, we have the Huntington's disease, neuroacanthocytosis, benign hereditary chorea, and Huntington disease-like disorder, and neurometabolic disorders. Because these disorders are treatable cause, always look for these causes like Wilson disease, Leishman, lysosomal storage disorders, amino acid disorders, Leigh's disorder, and porphyria. Now, what are the various drugs which can lead to chorea? Neuroleptics, which causes tardive dyskinesia, anti-Parkinsonian drugs also. So, one is the neuroleptics, another is anti-Parkinsonian drugs, then amphetamines, cocaines, tricyclic antidepressants, and OCPs. So, these are the drugs. In toxins, we have alcohol, intoxication and withdrawal, anoxia, carbon monoxide, mercury, thallium, toluene. Now, what are the various metabolic causes? We have hyperthyroidism, hypoparathyroidism. Thyroid is hyperthyroidism, and parathyroid is hypoparathyroidism. Pregnancy, hyponatremia, hypoglycemia, hyperglycemia, acquired hepatocellular degeneration, and nutritional causes like B1 deficiency leading to beriberi, B12 deficiency, pellagra. Infectious causes, we have the Sydenham's chorea, encephalitis lethargica, and Creutzfeldt-Jakob disease, various infectious and post-infectious encephalitis. In the immunological causes, we have SLE, Hinox-Schonle purpura, sarcoidosis, multiple sclerosis, Behçet disease, and PAN. In the vascular causes, we have infections or hemorrhage, AV malformations, migraine. It is an important cause of chorea, polycythemia rubra vera, and following cardiac surgery with hypothermia and extracorporeal circulation. Always do MRI to rule out tumors, paraneoplastic causes, and the trauma also, STH and epidural hematoma, which can lead to chorea. So in the miscellaneous causes, we have paroxysmal chorea ethetosis. So this is the etiological classification of chorea.